Dr. Joel Kim here from sunny San Diego, California. We've got the blue team working very hard on this very VIP patient. If I don't do a good job, I'm going to be haunted. So check this out. Doesn't get any harder than this. This is one of my colleagues that has severe right-sided back pain going to his thigh. And if you look carefully, he's got a spondylolisthesis at 4-5 and disc-based collapse at 5-1 with bone spurs. But it's the MRI that's really telling. It doesn't look like much on the axis, but if you look at the foraminal views, look at that corner right there, plus the tip of the supraarticular process going right into that nerve, that little gray thing. Same thing here. This one though has a disc protrusion as well as, because of the disc-based collapse, the little point of the supraarticular process is jutting into the neuroforamen and pinching the exiting nerve root. This is something that we would normally consider a fusion for. The fusion will allow us to jack up the disc bases at both levels and pull this back. But almost no doctor wants a fusion. In fact, most of my patients don't want a fusion because it's the F word, even though my mama has a fusion. She's doing great, but I get it. So we're going to try very hard to make room for those two nerves without destabilizing the spine so that hopefully he will never need a fusion. Wish me luck. It doesn't get any harder than this. No need to be sorry. We love you. Shot and save. Shot and save. Injecting dye into the middle of the disc. Shot and save. Watching it leak out. Shot and save. Oh, it's leaking out big time. Okay, foraminal stenosis, going through a transforaminal approach in a spondy. And trick one, instead of going to the disc, I'm going to go into that corner of the vertebral body, shot and save. Because that's what gets me as far away from the exiting nerve root as possible, shot. And that bony ledge is part of the problem. You can have the guide wire and a mallet. And a heavy needle driver if you have it. Customize everything to the patient. This is customized by not going to the disc and instead going into the bone right there. The guide wire that will keep it there while I do a little bit of reaming. May or may not go in, shot. Shot. Save that. That feels pretty solid. Okay, dilator, reamer, dilator, reamer. I'm not going to ream the last one now. Shot and save. For sure.
L5 left together.
Oh, you crazy. I was just talking to somebody about, I was talking to, he goes, just for like med legal reasons, like, no, we really use neuromonitoring for real. Okay, keep a really close eye on this one. This is the last reamer, which I said I wasn't going to use, but I reserve the right to change my mind. X-ray?
You have one.
Oh, shot and save. Are you recording? Okay, so I'm on the bone, not inside the disc, and I'm really far away from the exiting nerve root, and neuromonitoring is quiet, so I'm feeling pretty good about myself. And the reason is that, shot, this is helping me remove that posterior corner in one fell swoop. I'll finish it off with the drill. But part of the surgery is doing a bumpectomy. Shot and save. Oh, hell yes. Come upright. And let's take a picture on the way out. Yep. Stay low, just hug this. We need some WD-40 on that thing. All this must go with the burr. There's Wagner's arch after my colleague Ralph Wagner. He passed away at a young age, actually. And look at that bone right there. That should not be there. That's the corner that I got to remove. Right here. The laser will be really good for identifying that transition between the disc and the bone. And so there's the trigger flex. This trigger flex probe, you absolutely have to have it. Everyone uses this. Not everyone uses the laser. That's Wagner's arch. I'm going to follow that way north, but not until I get rid of all this bone right here. I'll do the disc later because the nerve is on the other side at 3 o'clock. Oh, I feel so good. Goes into bone. That was discovered by a dentist from Sweden by the name of Brannemark. Next time you go to your dentist's office, look at all the brochures. I'd be shocked if you don't have a brochure from Brannemark something. And he was doing experiments in a rat, bone healing experiments in a rat, and he used a titanium cage as a chamber to see what grows inside a bony defect. And when he went to get the cage out, he couldn't take it out because it was so grown into the bone. It's like, what the hell? And that's how dental implants came about. That's how all our titanium implants came about. That's how we know when we put in the metal implant with a porous coating in a total hip or a total knee, it will heal. Here's Wagner's arch right here, right up here. That's the bone spur, or the osteophyte off the body of L5. That's the pedicle, that's the, Wagner's arch is the pedicle. And then rising up is the outer half of the facet joint that we call the supraarticular process. And then if I kept going, that's where the exiting nerve root is going to be. And it's the tip of this bone right here that's pinching the exiting nerve root from one side, and that bone spur that I just worked on from the other side, and there's the exiting nerve root right there. Surrounded by its perineurium. I haven't stripped it naked yet, but right here, that tip juts into the nerve root every time he extends his back and stands up. Right there. I'm going to get that last though. The exiting nerve root is in here somewhere. I don't want to look for it. I like that it's protected by this layer of the facet joint capsule / ligamentum flavum, because they are one structure right here. It's like a thick, heavy drape protecting the exiting nerve root. I'm going to work right there. This is where the laser comes in. So friggin' handy. I'll take the laser next. Did you know laser is a backronym for light amplification through stimulation of emitted radiation? Say that. Try to say that 3 times fast. L-A-S-E-R. That's why it's always capitalized. Directed by a mirror, because it's a light. It's non-electrical, and you can dial it up to be powerful. You can even cut metal with it. So yeah. Pretty dang useful. I'll turn this up. Man.
Yeah, so the only thing
Look at that granulation tissue. It's like a wannabe facet cyst. Oh, hell yes. Save that, come on out. Mas mejor. I'm in the neuroforamen. I'm really
Close
like
to the
just
disc,
above
right?
the nerve root
Uh-huh.
exiting. So that would be the tip of the supraarticular process, the outer half of the facet joint. And the facet joint surrounded by a joint capsule, because it's a synovial joint. That joint capsule becomes confluent with the ligamentum flavum medially and becomes hypertrophic, and it can undergo myxoid degeneration and turn into a cyst. Now I'm using the cannula to shear off that little remnant piece. Now the regular tube, Terry. Anything, Ali? Yep, shot and save. Feels so good. So there's the nerve root. Look at it's plastered to the disc protrusion right here. Look at that. It should not be stuck like that. Should be able to slide with hip and knee flexion and extension, and it should be able to pulsate. Not stuck anymore. And I have the Pac-Man, the straight Pac-Man if you have it. There's the exiting nerve root. It's like there's irrigation in here, so it looks like it's just free floating. It's not, but it's no longer under compression by a lot. Follow it all the way out. Oh, it's happy now. It's somebody that's been compressed for so long, it's happy. Follow it all the way inside to there. And I have the paprika. I don't know how I did this surgery without this device, but I did somehow. Like a contortionist. Save that, I'm right under the pedicle. There. Save that, I'm going inside the canal. Oh, I'm feeling good. This is where the nerve root needs to escape from. And then here's where the bone spurs where I sheared it off. I drilled this part off. And then go to the next level, 5-1. Pay close attention, Ali. Need you, buddy. Shot. There's the exiting nerve root right there. There's the bump of the L5 inferior corner of the end plate. Okay, now I can sweep it out of the way. There's the L5 nerve root. It doesn't look nearly as angry, and it wasn't stuck down to the disc like at 4-5, so I'm glad we did 4-5. And by the way, the free running EMG activity went from a score of 6 to a score of 3 between L4-5 and L5-S1. So I'm really glad we did 4-5. I'm really glad we're doing 5-1 too, because I would hate to be here and not do 5-1 and find out we had to do 5-1 after the fact when I was already right here. That's the thing that's going right into the nerve root when you stand up and lean backwards. Tilt some more. Oh, I'm way out lateral. Nope. No. Right there, X-ray. Yeah, tilt a little bit more. More, right there. Oh, I'm way north enough. So that's the nerve root, X-ray. Yep. Look at that. X-ray. Save that. That is the nerve root in all its glory. I don't need to go much above that right there. So far, so good, guys. Kakapupu disc right here. It's not a disc herniation, though. It is the disc bulging out because of the malalignment. This level, there's a retrolisthesis. The level above, there was a anteriorlisthesis. Either way, the disc gets stretched out. X-ray right there. Save that. Look at that. I'm right at the pedicle, so I'm high enough. You can see the nerve root. Shut and save. Yep. Come on out. I just basically traced the nerve all the way out its neuroforamen. Oh, hell yeah. I'm way medial. I'm way north. Yep, that's the top of the pedicle. And all that is totally clear. Shot there. Yep, I'm at the pedicle there. Woo! Surgery all done. I got all the compression out. I reduced this overhang. There's the exiting nerve right there. Also needs to be free and loose. and mobile. And it is, I don't want to strip it of its blood supply. There's a nerve right there. Look away! Surgery is all done. It went absolutely beautifully. We did exceedingly meticulous and careful neuromonitoring. I was extra careful, starting way away from the nerve root and checking it frequently. I got a really thorough decompression, and the neuromonitoring signals got better. The free run EMG activity went from a score of 6, then after 4-5 to a 3, then after I did 5-1 to a 0, and that is a really good sign. So I'm expecting a great result and praying for a speedy recovery. So best wishes.